Good day, I'm Jackie Judd. If you've paid attention to the details of the healthcare reform law, likely you have heard about MLR. MLR stands for medical loss ratio. It refers to the amount of money most insurers must spend on medical claims and healthcare quality improvements, about 80%, versus what they spend on administrative costs. What does that mean for consumers and for the brokers who make a living selling health insurance? Here to answer those questions and more is Insuring Your Health columnist, Michelle Andrews. Welcome, Michelle.
Hello.
What is in the MLR, potentially for consumers?
Well, I think it's really a measure of value, that consumers should get value for their premium dollars, and that the vast majority of the money that they're spending out of their pockets for their health care should go toward the medical care that they receive.
And not the administrative cost, not the marketing cost, not the
profits.
Salaries, the profits, etc.
Exactly.
The insurance industry has a very, very different point of view, particularly the brokers and the agents who sell health insurance. What is their perspective on this?
Well, the brokers see it as a real problem because if their commissions are included in the administrative costs, then insurers now will have an incentive to reduce the amount that they pay in commissions because they can only put about 20% of their costs toward administrative fees. So brokers are worried that this will basically run them out of business.
And there's significant money at stake here. The National Association of Insurance Commissioners, according to the Senate Commerce Committee's preliminary analysis of data, shows that the potential consumer rebates would be cut almost by half if the agent commissions were excluded. So there's a lot of money at stake here.
There's a lot of money at stake indeed.
And is it possible that the law as it now stands may still change? Is Congress considering altering the outline of this?
There is a proposal that is under consideration, and I think there's a lot of discussion going back and forth about whether or not that's the right move. Of course, consumer advocates are arguing against it.
What is their argument?
Well, they are making the argument that if brokers are allowed to pull that money out of the administrative calculation, then that's a lot of money that's going to come out of consumers' pockets, because premiums then will be allowed to be higher than they would be if those commissions weren't included.
You wrote in one of your columns, I think you raised the question of, do insurance brokers face the same fate as travel agents, who have become very much less relevant in the process of travel these days?
Yes. Well, some would say that is an inevitable result of this kind of change, and it's going to happen whether or not their commissions are included in the MLR ratio. I'm not the expert on that, but I think that that's a real potential.
There was one early sign of how the MLR might work in practice in next year, when, if there are going to be rebates, they would begin to occur then. In the state of Connecticut, Aetna took a step forward. What happened, and why did they move in 2011 before they really had to?
Well, Aetna announced that they were reducing the premiums on their individual policies an average of 10%. The range was from 5 to 20%, which was a couple $100 for each policyholder, not an insignificant amount of money. And what they explained was that they had fewer claims. There's a lot of talk, about the economy's tough, and so people aren't getting as much medical care as they might otherwise get. And so they were collecting more in premium dollars than they were actually paying out in relatively more than they were paying out in claims. And so what the thinking is that they reduced their premiums now rather than wait until 2012, when they'll have to actually rebate the money to consumers if they over collect on premiums.
And so what you've just described, is this something that other consumers might look forward to come 2012?
Certainly some consumer advocates are saying they think it's the shape of things to come.
3 states so far have been granted waivers from the outline of the medical loss ratio as it now stands in the law. Which states are they, and what does the great waiver mean to them?
Well, I believe the states are Maine, New Hampshire, and Nevada. And then there are about a half a dozen other states that have requested it as well. And what it does is it allows, rather than having to meet that 80% ratio in in claims payments, they have a lower ratio. They only have to put 65% of the premium dollar toward claims, for example. And the thinking is that in some of these markets, if they make insurers keep that level at 80% or 85%, that it may actually push them out of the market, and then that would be bad for consumers. But there's an argument that they have to make and prove before that's permitted.
So this is something we're going to be hearing about between now and next year.
Yes, I think so.
Okay, thank you so much, Michelle Andrews of Insuring Your Health.
Thanks.